For 9 years, the Dettol-NDTV's Banega Swasth India campaign has worked on multiple programs that have related to health and hygiene of both humans and the environment that we inhabit. Now, these programs have also addressed many of the SDGs. What has been your impact or your experiences? Where do you feel that there has been a maximum impact?
Thank you so much, sir, for asking me this question. This is my 9th season with you. And in all these seasons, we started with a bus which used to go to around 30 cities across India, 7,500, villages we covered in the first season. From there to the journey, covering all 100% aspirational districts in India, working on, making sure you have the hygiene play parks available, making sure every school child in the public settings is having the hygiene curriculum, which focuses on hygiene at home, hygiene at neighborhood, hygiene during school, and personal hygiene, and many other aspects related to the same. We are trying to reach out to the populations which are, indigenous populations, and many of them actually really need very strong attention of ours. For an example, like the Siddhi tribes in Gujarat, which were brought in India by the Nawab of Junagadh, they are Africans. A lot of work has to be done with them, especially on the neonatal care, making sure the first 1,000 days of the child care is taken care well, or to the tribes in Rajasthan, where we work with the Kalbelias, Karnats, Rajnats, which are all nomads, and working with them and making sure the last mile access to the healthcare is being delivered to them. One new thing we have started inculcating the habits on the climate change too. We have just launched with NDTV the first climate resilient school in Uttarakhand. We have been witnessing in the news what's happening in Himachal and and other parts of the country due to the rains. So how to create the climate resilient schools? So we have done the first school, and we are going to the Char Dhams now in Badrinath, Kedarnath, Gangotri, Yamunotri. So we will be having the climate resilient schools, and the good thing is government is very keenly engaged in this work. And the Uttarakhand government has promised, the Chief Minister has promised us, once this model is set up, they are going to work with us throughout the state, and there will be all climate resilient schools which will be put in place. So our responsibility is not just to work on the hygiene, but to work beyond that, which is the concept of One Health.
रवि महत्वपूर्ण बात कर रहे हैं. रवि ने बात की कि एक कॉर्पोरेट घराने की क्या जिम्मेदारियां हैं. जाहिर सी बात है, संपूर्ण स्वास्थ्य का लक्ष्य अगर हम सिर्फ सरकार पर छोड़ दें या सिर्फ कॉर्पोरेट घराने पर छोड़ दें, उससे बात नहीं बनेगी. सब लोगों का साथ आना ज़रूरी है. बार बार आप एक शब्द का जिक्र कर रहे थे, SDG. अब जो ये नहीं जानता है उसको ये बता दें, इसका मतलब सस्टेनेबल डेवलपमेंट गोल. और अभी थोड़ी देर पहले जब बात हो रही थी तो उसमें ये कहा जा रहा था कि गरीब, आपका सवाल था कि गरीब को सबसे पहले ध्यान में ये आता है कि भाई मैं बीमार हूँ तो मैं अपना इलाज कराऊँ, इससे पहले मैं ये सोचने लगता हूँ कि मेरा खर्चा कितना होगा. मेरे ख्याल से ये एक बहुत महत्वपूर्ण सवाल है, और सरकार की तमाम स्कीम्स हैं इन सब चीज़ों को लेकर के. सरकार इसको किस तरीके से देखती है, स्वास्थ्य कितना बड़ा उसको कितनी महत्ता दी जाती है, कितना बड़ा प्रायोरिटी सेंटर है, और क्या क्या काम हो रहा है.